Hi everybody and welcome back to my channel. So I'm in a little bit of a different location today and I will kind of explain why in a second. But if you're new here, welcome. I hope you enjoy my channel. I post new videos every weekend, so be sure to check them out. If you're not already, go ahead and subscribe, hit the box down below. That way you don't miss out on any future videos. So today I am going to talk about what's in my clinical bag. So I just started clinicals yesterday actually, and I am back in the hospital, back in the swing of things. I'm doing my clinical for a nursing course at my school called Medical Surgical Nursing, nursing care of like the older and middle-aged adults. So I am on a cardiothoracic floor doing my clinical, and it was a really great experience I had yesterday. I think like over time, once I get more into the swing of things and more comfortable on the unit, things will be even better. So I'm really excited for the semester at that clinical site, and I will keep you guys posted on the experiences that I have while there. So if you're interested in maybe seeing like a video talking about what I do during clinical and what kinds of things happen, if you're like interested in nursing or if you haven't started clinicals yet and are just curious, comment down below and I'll be sure to try to get a video like that coming in the future. So let's go ahead and get started. I am going to say I'm sitting here by my front door actually because I don't like to bring things that were in the hospital, into the apartment any further, just because they could have germs on them. And I don't know, it's just like because of COVID, I'm trying to take extra precautions. So that is why we're here. This right here is our like front closet. So I've just been keeping my clinical bag and supplies in there so I don't have to bring them into the living room, into the kitchen, or into my bedroom. So let me start. This is the bag that I'm going to be using for clinical. So I actually just got this bag from Amazon. I'll link it down below. I'll link as much as possible down below. Some of the stuff you can't find like online, but yeah, so this is the bag. I got a bag, this one specifically for going to the hospital because I have another backpack, but it was a little bit too bulky. And I also, like I said, don't really want to bring that kind of stuff into a place where there could be a lot of exposure and germs. So I got this backpack. It was pretty cheap, but like I said, I'll link it down below. From Amazon, they have a ton of different colors, a ton of different styles, but it just works for what I need. It's like the right size, and it has a lot of pockets. So let's just dive in. I'll show you what's kind of in here and what I brought, and yeah. So, all right. In this side compartment, I'm gonna start. I have my ID badge, so I just keep that and I will wear it while I am with patients and in the hospital. It's kind of important, so people know who I am. I'm not just like a trespasser. And then I have my pen. I have a lot of pens in here because you kind of need pens to like write stuff down for everything. And then this other side pocket is for like an umbrella or something. It's a little bit too small for my water bottle. So if it starts to rain or anything like during a clinical day, I'll bring an umbrella. I also like how the backpack has this like snap close thing just so you could like hold everything together. It's more of a style thing than like a function thing, but we're opening her up. So first things first, you can kind of see inside here. There's a lot of room. There are these pockets, which are very handy. So I have my water bottle, like I said, because it doesn't fit in the outside compartment. So I'm just bringing my water bottle. And I like having my water bottle with me because you can like use, like on the unit they have, cups and ice dispensers and water dispensers for patients, but I just don't think it's like practical and environmentally friendly. So I talk about like necessity of having a reusable water bottle in another video. I'll link that up here. But that is why I bring this. And then when I come home, I like wipe it down with a Lysol wipe, just in case there's any germs on that, because I keep it at like the nurse's station and stuff. Okay, and then I have this case, which is, I believe from Amazon. I got it for Christmas a while ago when I got my stethoscope, but it is a case for my stethoscope. I also keep some other supplies in here. You can kind of see. So I have my stethoscope. This is the specific one that they told us to get. It's a Littmann stethoscope. I have like a sterile wipe. I also have some gauze here. You can see I'm not gonna pull that out, but I have a pen light. and some shears. These I got on Amazon, and I will link them below as well. But it's just nice to like have everything together, and then when I get to the hospital, I take them out and I put them in the pockets in my scrubs. Yeah, so that's handy. It has a little thing too, a little carabiner hook with a tag. So okay, and then this is a brown paper bag that they ask us to keep our masks in, because the hospital that I work at, there is a policy where they keep the masks in paper bags rather than plastic, because it just, plastic bags can breed more germs, I guess, and contain germs, so this can help. So that is that, and there is a mask inside, and they give us like a mask when we enter the building as well, and they also take our temperature. So there's a lot of good precautions in place. And then I have my drug guide. It's a very small version. I also have a drug book that is a lot bigger, but I decided to bring this tiny one because most of the charts in Epic do have the drugs listed, and you can look them up in a drug book online as well. So I don't really need to like have a giant one with me. This is just in case I have to look something up quickly. But this I got at a convention that I went to, and they just have like they're almost like little flashcards of the drug, what it's used for, what class it's in, and then like side effects and nursing considerations. So those are good, especially like the nursing considerations when you're going and administering the medication. It's important to like tell your patient why they're receiving this med and what to look out for side effects, just in case. So I have that little tiny drug guide. Okay, and then I have this from Anthropology, this like little pouch. This is kind of like a first aid, not first aid, but like, it's like just where I have like essential things that I might need, like self-care wise. So I have like hand lotion, because the hospitals get really dry. That's why like water is also important to have. I have like antimicrobial hand wipes, some lip balm, some like blotting papers here if I'm like oily, my skin, just like stuff like that. So that's just, tiny thing to bring. I also have like a small notebook. This is one that I've had for like years, and I just like found it and was like, this will be really nice for clinical, because it's like fits in my pocket on my scrubs, and I can just jot things down when I'm in the patient's room or trying to look at their chart or something. What else? I have my watch. Having a watch in nursing school is a necessity for like taking heart rate, respiration rate, everything like that, and even just like seeing the time. So definitely important to have a watch. I also think my school actually requires this, that you have a watch with a like second hand and not an Apple Watch. Like they don't want you to have a digital watch, because I don't really know the reason, I guess because this is more reliable, but yeah, so I just have this. It's pretty cheap. I got it on Amazon as well. I have a lot of things from Amazon in this bag. Yeah, but I think that is it for the main compartment. And then, my school gave us all face shields, and they come in this like plastic bag to carry them. I know I said that they like want to use paper bags for masks, but this I can easily like wipe down with a Lysol wipe, and then I just leave the bag open so it dries. All right, and then I have a snack. So I have some popcorn, just like a small thing to eat. I'm only there from 7 to 1, so I don't really need lunch because I can just come home right after and eat lunch. But it is helpful to have like a little snack if you're like, feeling like you need a pick-me-up during clinical, or you're just like really hungry. I also have my wallet. Just I have to be careful about like where I leave my bag because my wallet's in there. But this just has like my cards and stuff, just in case. I don't really need to buy anything at clinical because I'm not there for lunch. I don't need food or anything, but it's just good to have in case of an emergency. And then I have my sunglasses. These are for the walk there and the walk back if it's sunny. And I think that's basically it. Don't really need like to bring too much. I also like sometimes will bring like printouts of the assignments that we have to do. with our patients, some of the assessments, and I also have like some like tiny cards that I can bring around in my scrubs that show assessment, like the assessment flow and like what you're supposed to include, and some like just tip sheets that are kind of small and laminated and fit in my pocket that the school provided. So that's basically it. You don't really need a super big backpack or a ton of stuff for clinical, because then it just kind of like gets in the way, because when you're a student nurse and you're in the hospital, you're kind of just like a guest on the unit, so there's not a ton of space for you to like leave your stuff, and you don't want to like take too much room up in their break room. You want to be courteous about what you're bringing and where you're leaving it, so that's why my backpack's kind of small. I just kind of like tuck it in on the side, like where the other like student nurses stuff is, and I just have all of this stuff accessible in my backpack if I need it. Yeah, so that is what I recommend bringing. I hope you guys enjoyed this video. If you are a student nurse and you recommend I add anything else to my clinical bag, I would really appreciate some input, so go ahead and comment in below. If you liked this video, give it a thumbs up. That would really help out my channel. I hope you guys enjoyed this video. Like I said, maybe you found it helpful. If you're a nursing student, maybe you realize that you're forgetting to bring something important, but I hope you have a great rest of your weekend, and I will see you in a video next week. Bye.